Hello everyone, Dr. Charlie Ware here. Again, sorry I'm a little bit late for this live, but I had a couple of late patients that I couldn't avoid having to finish up with. But again, as you see, the topic is white blood cell count increase, infections, and what all this really means to the sickle cell group. Let me go up and also I start saying that the information I give is not designed to actually, treat or diagnose anyone. I'm just giving information to just give more value to your life and make sure that you understand everything that's really going on. And some of the questions I usually try to answer are the questions that people ask inside of our group, Healing Blends as well. So I try to, again, give you guys enough value to understand what's going on with sickle cell disease or arthritis or whatever it may be. But again, we're talking about sickle cell disease today. So let me begin. White blood cells, or WBCs as it's called, is actually we measure inside the body, and is a range that goes from anywhere from about 8 to 18 or 11 to 18, depending on the age of the actual person. And if you're out of the range, that means that there's some sort of underlying infection going on inside the body. Now, there's further breaking down of what the white blood cells do, or what types of white blood cells. You have neutrophils, monocytes, you have basophils, you have lymphocytes, you have different ones that do different things. Say, for instance, you have an increase inside of your, let's say, eosinophils. Eosinophils is another type of white blood cell that actually, when there's increase, it shows that you actually possibly have a parasitic infection. And then if you have a monocyte, that can just be a generalized chronic infection that's sort of going on somewhere in the body. Neutrophils, if you increase with neutrophils, again, it's just a sign that you have some sort of infection. But what happens is this, more importantly, that some of these things, even with white blood cell count, but with neutrophils as well, an increase in those can actually indicate that you can be under a lot of chronic stress, putting a lot of stress on the body, which is making your bone marrow either produce more red blood cells, or which causes your white blood cell count to increase, because again, the white blood cells are really stored inside your bone marrow. So if you increase in the ratio of that, or the production of that, the bone marrow, you're going to increase your ratio of white blood cells as well. So what all this stuff really means when it comes to a sickle cell patient, that means is putting added stress onto your body. Now, say for instance, I'm sorry, I apologize, I moved a little bit further. Lymphocytes basically means that you can have a bacterial, viral, or a parasitic infection as well, because there has to be a distinction what type of infection that you have inside your body. Most of the time we hope that's a bacterial infection. It means that we can sort of give you something just to get rid of bacteria inside your body, to sort of get rid of it, and you're back better. A lot of times women possibly have a latent like bacterial infection inside of their vagina called like either vaginitis, or you may have a recurrent yeast infection. And then they'll get tested, it'll get swabbed, and then you'll see that a lot of these numbers are elevated. And again, once you get the proper treatment, those numbers drop back down to normal, and it's over and done with. But that's, again, just one case as an example. When it comes to sickle cell patients, any sort of extra stress on the body can actually put the body into further stress, and also further pain. I'll finish that statement out. So, case in point, I had a question from our group recently. Someone was asking, my child's only 4 years old. She had a white blood cell count of 23, which again, I already said it's supposed to be around 18. For a sickle cell patient, the white blood cell count may be elevated, again, just because your body is trying to produce more red blood cells, which come out of the bone marrow, which in turn is going to be a balancing act with the white blood cells as well. But in this case, the child was actually sick. And if it was a viral infection, it wasn't much that the clinic could do to actually make the virus go away fast or whatever. Sometimes the virus has got to run its course. Things like increasing the zinc, increasing the water intake, or the electrolyte fluid intake, the chlorophyll, and also a few of our other products that can actually help to push the virus out of the body faster, will get the child better and faster, but also it will also help protect the body long term. But just to answer this question, is the fact that a lot of times what happens is if it's a viral situation, and especially at that young age, and especially having that high, we know that the patient is already in a sickle cell crisis, which can increase the white blood cell count. What happens sometimes in other settings is when you get your blood count or CBC, complete blood panel essentially, and they see that you're either in a sickle cell crisis and they see that the white blood cell count has increased, they may say that, okay, well, now you have an infection. So what they automatically do is they give you an antibiotic, not per se understanding that or remembering, should I say, because they can't pinpoint where the infection is, but they're going to give you an antibiotic just in case. But then what if it's just because of the fact that your bone marrow is now producing more white blood cells because you're in a sickle cell crisis, so you need more red blood cells in order to battle the crisis, to get over the crisis a little bit faster, but then now they're going to give you the antibiotics. What happens is that will put, again, more stress in your body, and actually can sometimes prolong the rate of the actual the actual crisis as well, because your body's now fighting some unknown bacteria that is not really there, and yada yada yada. There's a whole cascading effect that goes on. So I try to have patients realize that, you know, certain things happen in your body when you go through a sickle cell crisis, or some reasons why your white blood cell count is higher than other times. It's not per se an infection, it's because of the fact that what happens inside the bone marrow itself. The physician, and also include myself, sometimes have to go and dig a little bit deeper to look at other numbers like the neutrophil rate, the lymphocyte rate, all those things to make sure that, okay, is there something really going on? Is it there truly an underlying infection somewhere in the body that we're not seeing? Or is it just the fact that your body is just producing a lot of bone marrow, in turn produce more red blood cells? Now, again, as I already said, the neutrophil rate may be a little increased as well because of the fact that if you're under chronic stress, your neutrophil rate could be a little bit higher because of the amount of cortisol and the amount of inflammation that's in your body as well. So I see a lot of patients that have higher neutrophil rates, and I know most of those individuals are under high stress situations. So we try to get them to de-stress themselves and get all their lab work back in order. It's a whole process we actually sort of go through. But the whole premise of even going through this this Facebook Live, was really to try to explain to you several reasons why the white blood cell count might be higher in sickle cell patients. And like I said, it's all because of the production of the bone marrow. Again, traditionally, you know, we have either low red blood cell count inside of our body naturally. We have faulty red blood cell count naturally because of the fact that the amount of sickle cell cells inside of the body itself, which is going to put more stress on the bone marrow to produce more red blood cells count. But along with that is a ratio of that, because again, the white blood cell count production will also go up too. So a lot of times, you know, it's not completely alarming unless, you know, your child has a cold or a flu or has been exposed to some sort of bacteria, and that's when the other types of white blood cells or other infection and fighting cells in our body have to be also measured, and look at the ratios for that too. A lot of individuals, like I said, when they go into the hospital for a crisis, a lot of them complain about the fact that now, you know, oh well, they found some sort of infection. And I asked, well, what was the infection? Most of them can't understand or know why, or know what the infection was or was not. Just again, be careful with the amount of antibiotics you guys are taking too, which puts more stress on the body as well. So again, it's a simple thing of just knowing. It's better to know than not know about your white blood cell count. But it's more important to look at the other aspects of it, because we have found quite a few individuals that have been on antibiotics for a long period of time, and now it's really affecting their parasitic rate, which means that you're more susceptible to getting certain parasites inside your body. And yes, even here in the United States, there's still a lot of parasites inside of the foods inside of people's gut that they're unaware about as well. So again, if you guys have any questions at all, you know, feel free to actually give me, you know, some comments below, give me some thumbs up, some hearts, things like that. If you are finding this information is very useful for you. Again, some doctors explain this stuff very in depth, and others don't. They say, okay, well, we found some sort of infection or whatever, but if you guys have questions, always feel free to give us a comment below to answer your question. We try to get back to you within, you know, 10 to 24 hours. Just depends on how long. So, again, thank you so much. Take care. Have a great night.